Welcome everybody. This is Olivia Nava with the Goby Group. I think Lucia is going to get us started.
Hello everybody, this is Lucia Corral Peña. I'm the Senior Program Officer for Blue Shield of California Foundation. Thank you so much for joining this informational webinar on the request for applications that the Foundation released last week. It is titled Prevention Approaches to Break the Cycle of Domestic Violence. On today's call, we have a few of the team members from Blue Shield of California Foundation. And on the line, we also have the leads for the Goby Group, who will be facilitating and implementing this co-design lab in partnership with the Foundation. First, let me say thank you so much for your interest in this RFA. We are really excited to be releasing what is a first project in the implementation of a new strategic plan that the Foundation is launching this year. The request for applications is a design lab that Goby will be describing more fully in a few minutes. What I'd like to do is tell you very briefly about the Foundation's interest and why we are releasing this co-design lab. At the Foundation, at Blue Shield of California Foundation, we believe it's possible to improve the lives of all Californians. For those of you who know our foundation and who have been partners with us, we are excited to have you on the call. And for those of you who are not familiar with us, I'll share that our foundation historically has funded in two priority areas: domestic violence, ending domestic violence, and improving the quality, accessibility, and affordability of healthcare. Over the last 16 years, we have dedicated our mission, our resources, our time, our talent to achieve that mission, and we've been in a very reflective state over the last couple of years to think more about how we can really make change in California. We have always collaborated with our partners, and as we position ourselves for deeper impact going forward over the next 2 years, we want to collaborate with forward-thinking partners who are committed to seeking out the best and most innovative solutions that advance everyone's well-being, and most especially the most vulnerable. We believe strongly that when we work together to improve the lives of those who struggle most, we create a California full of possibility. We are in a moment of exploration, inquiry, testing, and leading in the space of prevention. We are also more, the Foundation obviously is part of an ecosystem where we have lots of movement taking place around us, and we are in a moment in our country that demands inclusion and equity to get us to what we really think is a moment to really advance equal opportunity for folks to work, live, and play free from violence. And we want to leverage opportunities to create more safety and do so in conditions that honor who we are and that lift communities, families, and individuals up. And so in that spirit, we have been wanting to really look at the way we've been operating and the fields that we work with and think about where we have had some real successes. And we have, over the last 5 or so years, really been testing some models around cross-sector partnerships. And we have really been inspired by partners in the field who can think cross-sectorally, intersectionally, and we are now looking at really thinking about how do we build bridges and not tear down silos or not build more silos. So this co-design lab is really exploratory, and we are looking for a mix of folks who will really be partners with us and really be willing to kind of think outside of what they do day to day, and yet bring what they do day to day, the talent, the brain power, the passion, the commitment, the care for communities, and bring all of that commitment to a table where we can think differently about how we really prevent what we in the foundation called wicked problems. And in this case, this is about ending domestic violence. I am now going to hand the baton over to the Goby team, who will tell you a little bit more about who they are. But I will just say that it has been wonderful. The Goby Group is a social impact design group who is bringing a lot of acumen they have in the healthcare space and in design thinking, to think differently about some of the issues that we care about, and then partner with not just us, but the design team fellows who will really help us, hopefully, break, think outside the box and create new ideas for us to really move and make some change. So with that, I'm going to pass the baton over to Olivia Nava.
Yeah, thank you, Lucia. So I'm, as Lucia pointed out, working with, we are Goby Group. We are a social innovation design firm out of Oakland, California. And just a little bit, we work domestically and internationally in healthcare, technology, education. A lot of what we're doing more recently is in the healthcare field. And you can learn more about us. We're on page 9 of the RFA or at gobygroup.com. I realize we don't have a ton of time. So I am going to get started on just a little bit of the logistics. So I see that there's not a way to, verbally communicate with us. And what we are asking is, if you have a question, to put it in the chat box. I'm here with my colleague, Jasper Sandu, and he is managing all the questions that are going to come in, so we can make sure that we maximize the time that we have. But I do want to kind of walk through some of the components of the RFA in order to make sure that, we're being clear with what the ask is, and sort of what we want to make sure that you have enough room to be able to ask different questions. If you're on your phone or not online, we have a small slideshow, but you can always email at labs@gobygroup.com during this webinar, as well as anytime you have a question. That's where you would go for seeking answers or having any getting more clarity about the application. So I'm going to start with what the Design Team Fellows is. We're looking for 12 to 15 individuals that come from both inside and outside of the domestic violence field, that mostly are just passionate about ending violence for whatever reason. We want the individuals to be very creative thinkers, someone who thinks of themselves as a creative thinker and also a collaborative person. And you'll be working with other people as the design team fellows within 5 different labs that are happen throughout the year. And then there's a culminating event in late July. That's the sort of larger summit or convening, where we'll be able to bring in other voices that aren't part of the lab into that space. As Lucia had mentioned, the theme is about prevention approaches to breaking the cycles of domestic violence. So we're very much looking at what are kind of the investments that we can start to make now, or what are the thinking that, and the risks that we want to take now in order to think, generations beyond today. In terms of the participant makeup, we're looking at a wide range of sectors. So we'll have a subgroup that will definitely come from the domestic violence field in order to bring that history and expertise and context into the room, but we also are into the labs, but we don't want to limit that thinking, because that's the whole point of using the sort of the human-centered design process, is that you're bringing in lots of different ways of thinking, people with different life experiences, people that have different approaches to solving problems. And that's where we're looking at whatever your expertise is. That's what you're trying to kind of point out, is like, we want people that are able to represent different sectors or just different points of views. So we're looking at people from, and we have this very broad intentionally around family, children, youth. That could be from anything, whether it's, you know, working in just with youth programming to education to whatever that means to you. The equity being from different social justice lenses, whether that's, you know, environmental justice or whatever types of criminal justice, you know, like just different types of aspects of what you think equity means for California communities. And then in the communities, that's really broad. That's whatever community you think you represent, whether that's LGBT to tribal to whatever that you think you have that really strong understanding in. We think healing is going to be a really big part of understanding prevention approaches for the future. So that can be faith-based to psychology to whatever that might mean for you. And then looking at arts, media, journalism, we really want people that have a different look at, you know, what communication avenues can look like in terms of thinking about this work in the future. And then even beyond that, you know, we are very open to what the sector could be. I think the main thing is that you have a way of positioning how this is going to be a partnership to end violence. Human-centered design is our expertise, and what it is, it's a collaborative problem-solving approach. It's very much collaborative and creative, and at the heart of it, it's a process, it's a approach, and it's a mindset. So, but at the heart of what the approach is really understanding the end, what we, you know, sort of broadly call end user or beneficiary to the work. And that can, in this work, that's going to mean a lot of different things. So there's a large part of the process that focuses on understanding all these different types of end beneficiaries and users and exploring how we can position sort of different strategies or thinking around putting this user at the service of what we're trying to design for. There's a lot that we can get into in human-centered design, but I'm just going to kind of leave it at that for now and get it. And a lot of what I said, the mindsets are really what come out in terms of what we're looking for in the application criteria. What you get by becoming a design team fellow, there's a lot that we see as this process is bringing in new people into your sphere of work. Whether you're somebody from outside of domestic violence and sees has often thought of ways that your work could affect ending cycles of violence, then that's where you're going to be leveraging some of the best thinkers in this world. If you're from within the domestic violence field, then you're going to be positioned to have these really unlikely and new partnerships that maybe you never thought of or really saw the connections to before to really leverage the work that you're already doing. We'll be teaching a lot of human-centered methods, so you'll have an experiential understanding of what the human-centered design process is. And we're hoping that these methods are methods that you can then use in your work at your organization, whatever type of organization that is. The thing about human-centered design is the issue area is very agnostic, so it's very applicable to many different fields. And then also that you're going to be inspiring a lot of the thinking for the future of this work and bringing in your different perspectives, not only to inform the Blue Shield of California Foundation's future thinking and programming, but also looking at, we're really going to be deliberate and intentional about how we can create artifacts and assets about how the team arrived to the end thinking of through the entire process, and how to communicate that to the broader field and fields, the different sectors that will be influenced by wanting to figure out how they can also end violence in California and for California communities. The key dates for this process, it's a tight process and we recognize that for the applicants. We did just launch this on the 22nd, and we are seeing that we want the applications back, and they are due on the last minute of March 12th. Applicants will be notified by no later than April 3rd. The first two dates of the first two labs are mandatory, so we ask that you are able to attend those. The first one, which will be starting the late afternoon of April 16th, and going in all day on April 17th, will be in the Bay Area. The May 23rd and 24th dates will be late May 23rd and all of day 24th will be in Southern California somewhere. That's a broad, we're like, we're open to where that could be. And then the June, August, and September dates will be determined a lot on where the design team fellows are coming from. So we want to make it so we're getting around the state and that everybody kind of has an equal opportunity to, showcasing or locating into in their area of the state. There's a 2-day convening that's also mandatory. That'll be in July, and this is a bigger convening. We'll be bringing in a larger number of people into that into the meeting. So the dinners will be an opportunity for the team to there's a strong team forming phase in this process. So there'll be a lot of time for folks to understand each other kind of informally before we get into the formalities of the actual design labs. In looking at the application criteria, this is a lot of the mindsets that we're looking for in terms of when in most human-centered design is we definitely want you to have an expertise area, whatever that is for you, and you'll be highlighting that in your application. So we will want different expertise areas coming into the lab. We want everybody needs to have a genuine interest in this, in not only the subject matter, but in working with other people from different backgrounds like that, thrive in working in diverse groups. Collaborative personality and open-minded. And then this idea of being able to operate within ambiguity. The design process is ambiguous. And so you don't have to be comfortable with ambiguity or fluidity in thinking, but you have to be able to know that you can, even though you're uncomfortable, you can still operate within it. Problem-solving mentality, very self-explanatory, and then a willingness to perform homework. So there will be these sessions that will be, introducing methods, and because we want a lot of understanding of the different ways that the different communities and individuals that violence affects, we're going to need different methods to bring those voices into the design lab process, and that will be through different ways that we'll be doing it in the design of the actual labs during the time that you're at the labs, but also bringing in the constituents that you represent and the voices that you think that you need to be bringing into the room. So having some homework that will be a part of that, and then how to apply. It's an online application, so there is a note. You will need a Google account to apply. That is because there is a video component to this process or to the application. And in order to have an uploaded video, you do need to have a Google account to do that. If that's not possible for you, please email us at labs@gobygroup.com. The reason why we have a short video component is that we want to be able to see you. And I think a lot of times in written applications, that either the written form is not the best way people represent themselves, or people might have a more creative way that they'd like to show themselves. And also it's we get a better flavor of a person when they're talking to us than through the written word. So that's why we have it. It's we strongly encourage it, but if for whatever reason that makes you uncomfortable, then that's fine that you don't include it. It's intentionally meant to be very low fidelity. So it's a continuous uncut, as in unedited, talking into your smartphone or talking into your computer video, and just cut it and send it. Like, we don't want it to be, the technology to be prohibitive for anybody. And then the request for applications, if you haven't found it, this is where you can find it. And we'll have this whole webinar up on the Blue Shield of California website, and that some more information will go out to everybody about how you can access that. So we have some questions that have already come through for us in prior to this webinar, and then I think we don't have any so far. Okay, that's good. So in terms, you will have asked, is this a total volunteer effort? There is a modest honorarium, and that's because we do recognize the time you are taking away from your work. And so it's a starting point of $5,000. But it'll be, the amount will be considered a little bit based on the final number, as well as recognizing that some people might be coming from very far away places that are, frontier or way in the desert or whatever it is, so that their travel time is actually more for them than it is for people that, say, are based in the Bay Area or in the major cities. And the honorarium can go to the individual or the organization. That is up to you. We do want a broad, diverse in terms of age diversity. So we do want young adults to apply. I think the basis for anybody that applies is that they're very comfortable speaking their mind and are comfortable in a formal, meeting environment. In terms of, people sitting around a table and talking or having invited, listening to people speak, and that format is comfortable for them. So we do have asked that everybody is a legal adult, and that's for various reasons. We are open to applicants from not outside of California. It'll be like a must-have type of individual that becomes highly recommended just because of the nature of that. There's a lot of travel that is involved in this. We do need to limit that to 1 or 2 people. But other than that, we're going to look to the chat box if there's any other additional questions that came in. We don't have any right now, but if you have any comments or questions, we'll just kind of open that up.
First question. I'm just going to read these to you. The first question is from Lisa. She asks, what does success look like for you all at the end of this process?
Yeah. So in terms of success, I think that there will be a clear understanding of the not only the programming, but I think also in terms of there'll be a lot of futures perspective thinking as a part of this work. And I think, yeah, Lucio can jump into it's probably better.
Yeah, what was the question?
What will success look like at the end of this process? Lucia?
Yeah, no, you can continue answering. Okay. I just didn't hear the question.
Oh, sorry. Yeah. What will success look like? So the success factors will be that there's going to be various, there's going to be a roadmap of some sort for the field in terms of what are the different kinds of investments that would need to be seeded now. Like if we're looking at this in terms of what are the risks that can be taken, and that the Blue Shield of California Foundation will have some usable ideas around how they can see themselves sort of seeding that those maybe riskier or new ideas that will really impact the future of ending violence, more broadly speaking. And then it's something that's going to be usable for the field, that people that work in domestic violence, as well as showing new connections of how people outside of domestic violence can incorporate their work into this.
So this is Lucia. I have some things to add to that response. So a couple of things. So the investments in the domestic violence prevention field have been pretty narrow, and we think that there's an opportunity really to broaden to broaden both the knowledge base and also to try new things. And the question is, with the right people around the table, what would those new things be? And when we think about new directions, we're also thinking about new mindsets. And I'll share just one that relates to the foundation's thinking. We have had the privilege of partnering with the Domestic Violence Safety Net pretty exclusively for the last 16 years. And I think one of the things we're thinking about is how do we leverage those that tremendous strength into the space of preventing domestic violence while also honoring the importance of crisis services. And in that space, we're testing our own assumptions. One being, for example, very much focused on the intimate partner relationship, one-to-one. And then, really thinking, okay, what we know and have learned in our experience, IPV doesn't just impact the two individuals in a relationship. They impact the children. They impact multiple generations. They impact families, and it impacts communities. Our own strategies haven't considered that. We know other people are considering that, and this is an invitation to people outside of our foundation to be thought partners, innovators with us as we move in this new direction. I will say that this is not the only thing that the foundation is doing. We are going to be trying other things, but in this space, what we are excited about is really tapping people that we probably haven't tapped yet. We expect that people who we don't know will be applying for this design lab. So we expect to have perspectives we haven't heard, and also perspectives we have heard. And then also having the design team members really try out new ideas that may just feel very different, perhaps even uncomfortable for us and for others. But really the importance here is, how do we advance both prevention of domestic violence for our outcomes around giving everybody the opportunity to live violence-free, play violence-free, work violence-free. And so, and how then do we do that? And this is an invitation to partner to do that and bring new ideas to the table. So success would be both the process of creating a space where people feel comfortable in providing new ideas, and on the back end to really have learned something new and different, and also perhaps affirming some of what we know. But I think if we haven't come up with something new, at least some new things by the end of the process, then I think, we haven't really tested quite enough. But I have no doubt, based on what I know, just in the DV field, that there are some brilliant people who are asking critical questions. So if it was just the DV field, I know that we would get there. But I'm actually excited about mixing it up and bringing new perspectives to the table that can generate some new ideas. And so that to me is new ideas, new solutions, and perhaps even some things that didn't work that have been tried that we don't know about, and learning from those things too. So I will say that it's a long answer to the question, but I hope what you hear is the desire to co-create, to reflect, to learn together, but also to try new things.
Thanks, Lucia. All right, we have some other questions that have come in. There's how important is having experience in prevention? So there's a couple of ways that we're looking at this design team. It's important for some people to have a lot of experience in prevention, but it's not important for everybody. But I think in answering, speaking to the questions, there's different sort of spectra that we're looking at. And I think, we definitely want people to have different levels of experience in some aspects of this. But I think the main thing is that you have an area of an experience, and that we're looking for different types of ways that people might approach problems, or people might think about risk and things. People that might have experience in prevention is a part of that. So we have another question from Sydney. What happens at meetings? What's the overall project and/or deliverables? And is it open-ended process for groups to plan and produce outcomes? So this process is very iterative. I think we have some ideas of what's happening, in the first few meetings. There's phases of the design process. So there's sort of this exploratory or understanding phase where people are coming from different points of view. So we're going to have a need to really understand the space, understand the different people that are involved in domestic violence, and and then it's really an open process of how people want to think about that. So that's part of the exploratory process, even within the group, is that not everybody's an expert, but they might have a new way of thinking about who this user or end person that might be potentially affected by violence, or at risk, or someone who's already been sort of maybe as a survivor of violence. So there's different ways that we will approach that. And the actual labs themselves are going to be somewhat, there's going to be a point where there's going to be invited speakers, people that maybe represent survivors, people that we might have different ways that we bring the different users into the room. We are going to have definitely a point where there's going to be a learning aspect to it in terms of understanding different points of view of the subject matter, as well as then having kind of more exploratory brainstorming sessions that are going to be different ways to think about the work, or I think a lot of it's going to be very much iterative based on who the group is. And then the different types of deliverables are going to be different communication deliverables about a lot of storytelling on the stories of the different design team fellows, as well as the process of the design team process, and then overall how we arrived at the recommendations that kind of came through in the end. I think the group does have the ability to influence some of the outcomes, but like I said, it's a very iterative process. Lucy, did you want to add anything to?
No, I don't have anything to add to the process.
Great. Okay. Other questions? Oh, okay. So then we have one. I'm actually going to pass it off to my colleague, Jess Paul, who's one of the principals at Goby Group, who can talk more about some of how we've used the design approach. So can you give an example of outcomes resulting from your design approach applied to other issues?
Hi, everyone. This is Jaspal. Really great question, and I hope I can do it justice. I think there's been a number of ways that we as a company, Goby, have employed design, and then some of us in other spaces outside of Goby as well. And that's for everything from strategic planning to design of new experiences, services, and sometimes products. As I think Olivia's talked about, like our focus at Goby is really social impact and really driving positive change in the world using design. So we've worked quite a bit here in the US, but we also have a global focus with our portfolio of past and current work. So everything from a long partnership with the Public Health Department in Alameda County that resulted in the launch and development of an ongoing community innovator program in Deep East Oakland. We worked with the Center for Care Innovations for many years here across the state of California and in New Jersey as well, supporting various federally qualified health centers, in some cases county health systems, with insourcing the design process. That's essentially training leadership and staff on how to do human-centered design and any number of innovations related to care, access to care, and increasingly prevention. An example is that we worked with CCI based here in Oakland and the San Francisco Department of Public Health on the no-show challenges that various clinics had around the city. Started out looking at text messaging as a solution. There's a really strong incentive to do that, and through the design process ended up with a solution that might not have been as shiny or polished as text message. It was a telephone visit program, but really was justified in the end by measurable outcomes and real impact on no-show rates. We launched a company that provides adult learning services on the go for immigrant communities. We're currently working on in East Africa, human-centered design for data use in the health system. So it's a lot of different ways that we have employed design. I hope it's not too scattered of an answer for all of you. I think for us, what's most important is that we're very confident in our approach and our framework, but we're really hoping to create something new here. That's the intent of this this overall effort that the foundation is leading, is that while we've got the framework, what we really need is the right set of people, the right set of leaders in traditional, non-traditional ways to join this effort and really drive it.
So we have a couple more questions that came through. The criteria for funding is a question that came up. Just a note that participation in the design team fellow lab or the co-design lab does not in any way influence, there is going to be future funding based on some of the recommendations of this lab, but it does not mean by participating in the lab that you get fast track to funding or that you're influencing funding. This is not, we're not creating a funding program. What we are creating are recommendations for the field. And, but having said that, there was another question about how much creative control does the team, oh, go ahead. Somebody else, Lucia, did you want to pop in?
Yeah, Olivia, I just want to maybe clarify something you just said, which is I'm not 100% sure where the question is coming from regarding funding, but I do want to say that this is an input. It will inform the foundation's kind of strategic thinking at a high level, but this group is not defining strategy for the foundation. And let's see. So it will, I can't say that it won't influence. I think the process is going to influence. It already has been really thoughtful, and there isn't a commitment to fund any concrete recommendations coming out of the process. So I just want to make sure that we distinguish between the honorarium, which is to honor people's time to participate in this design team, which is not technically funding, but it's an honorarium, versus funding opportunities from the foundation. Those are two very distinct things. So I just want to make sure, I'm not sure I fully understand the question, but if it was going, I want to make sure I understand, I answer maybe two different questions. If there are additional questions related to what I just said, feel free to put them in the chat box, but I want to put that out there clearly.
Yeah, thanks for making that clarification. Yeah, because I guess, there is the honorarium, and that is very different from what might come out of this in terms of funding. So there was another question on how much creative control does the team get overall. The team will have a lot of creative control. I think it's, for us, we're facilitating the process. And the idea is that we're going to try to tease out all the creative juices that are sort of within the team, and really wanting to get people to think differently, and that's sort of on our job. But we're sort of just kind of leading you along in this path, and there's a lot of creative control that the team will get overall as part of this process. And that's why we kind of don't design every single design lab from the get-go. A lot of it is based on how the flow of the conversation and the thinking is going in real time. We're definitely going to have a lot of intention around the first design lab, and from there we get an understanding of sort of like who's in the room, what are the different ways that people are thinking, what do we need to bring people up to speed on in terms of the content area. How do we make sure that we're getting a full picture of the issues that we're going to need to sort of address. And so there is a lot of creative freedom, I would say, but at the same time, there are going to be, there is constraints in design. Is not just as much as it is we want to have you, think kind of broadly and use divergent thinking. There are still constraints in terms of we are looking at prevention approaches. So we're not going to, we're not going to stray from that. So that's definitely a part of it, but the sort of framework that or the different issues that we want to bring into the conversation can be still quite open. And there might be other design constraints for that come up along the way that might be dictated through the foundation, because this is something that I think we can go two ways. We can think about it for the field, and then at some point we do need, a lot of the recommendations will need to be usable for the foundation. So we'll bring those in as we need to at the right times. But we do want to make sure that people have the ability to think really broadly. And then how will will work be followed up by any project? So I think Lucia kind of answered that. And then our Blue Shield of California representative is going to be at the meetings and dinners. Yes, they will be at the meetings and dinners, especially in the early, for the first design lab. And then again, it's a very iterative. If we will understand, kind of how people, I think they won't be in the full meetings and dinners. The idea is that they're not a participant. They aren't one of the fellows, but they are going to come in, sort of to kind of introduce sort of the process and how they got to wanting to create a co-design lab, as well as, they are going to be at the dinners, just to sort of know that, that they are kind of the hosts of this project. So they will be present in that capacity. However, and then during the big 2-day summit convening, they will have a really big imprint at that convening. However, past that, it'll be iterative, seeing when it's necessary to bring them in and when it's not. The number of people per organization, we're asking that only one person from each organization apply. So yeah, that's a very much intentional thing. So figure out who you think would be the best person from your organization and have them apply.
That's 2 questions from kind of addressing the same
point.
Okay.
So we have a question about not being able to come to one of the first 2 sessions. They are mandatory. So, I mean, if you feel that you're this, like you must be in it, I don't think I think it's a high, it'll be hard for you to miss the first one. I think because there's so much on the team forming importance that to miss the first one would be really difficult for the team to come together later on, because I think trust is, especially in this area, the content matter there's going to be a lot of intentionality and team just development that will need to happen in that first meeting. So I apologize that if people can't make it.
And then somebody, I think, had the question about, like, what if they miss one of the first 2? Does that disqualify them?
Yeah, if you miss, I think missing one of the first 2, is gonna definitely disqualify you from the others. I think if you have to miss one of the later ones, that's a little bit different, but because you don't know the dates, and I think that's also because it might be impossible for us, even within the design lab opportunity, to all figure out the best, that everybody can get together for the for the June, August, and September dates. But we do expect that people will be able to make all of them. If you can only make 4, that will just be what it is. But the first 2, I think, are going to be really important not to miss.
Question.
And then we have the last question, or I don't know, we have time, we have 10 more minutes, but we have only one question left. To what extent will you bring forward information about what works, doesn't work within IPV prevention? Or intimate partner violence prevention, since not everybody may be an insider. Yeah, so I think that's a lot of what we're gonna, so we've been in sort of, we're working with Blue Shield, and also that's why we will have DV experts in the room, is that we're gonna wanna bring forward a lot of what has worked and hasn't worked, and examine what hasn't worked in the past. And I think that's where we need a lot of, where the experts will be able to kind of speak to that, but that why we rounded out with people from other sectors to kind of challenge, well, is the reasons why you think it didn't work the reasons, or can we leverage some of that learning to kind of, redesign how we might think about the things that didn't work. And in terms of things that do work, how can we go deeper into some of those solutions to be able to leverage what's already been happening in the field, because we don't obviously want to just redo something that's already happening, but how do we think about it differently, or how can we amplify the things that do work? Lucia, do you have anything else to add on that one?
Let's see. Well, I'll just say, this is my own thoughts, is that I think what we know works feels somewhat limited. Meaning, we've been doing research on interventions that work, and there are clearly some, if you look on the CDC website, there's some great resources, and, there is a lot of work to be done in this space. So I think that what works is we know some things, we don't know a lot of things. I think it would be important for us to really lift up what folks think is promising. What I will say is we recognize that California's diversity in so many different ways, both culturally, economically, geographically, really matters. One of the things, of course, we know is that what works, you know, maybe in an urban area may not work in a suburban or rural area. So I think that this is a rich area, and one that, you know, demands change, and change is going to take a long time. So we, you know, one of the qualities that I think I'm looking for in fellows is to be thoughtful colleagues, but also folks who have the courage to say that does not work, or that does work, but only in this instance, not in this instance. Or, you know, the ability really to think about be open to what could work, and have the courage really to speak up. So I think there's going to be a lot of brilliant people around the table, and I think there's a mix of qualities we're looking for in some folks to say, you know, bring in what you know about survivors and children and families and communities, and raise important questions. And I think, you know, what we're looking for again is a mix of people who know how to be in a group like this, who are open thinkers, but also have important points of view to share and are not afraid to lift them. We want to be grounded in lived experience, and that is going to be really important in terms of finding the solutions that work for individuals, families, and communities. So all of that, I think, comes with thoughts about what can work, what doesn't work, and in the space of possibility, I think that that's where we are going to be exploring some of the edges that we all share in learning in this space.
Thank you. So I don't think we're, oh, yeah. Okay, I think we're done. There's no more questions. If you do have additional questions, please do email them to labs@gobygroup.com. We are gonna put up these questions and this webinar. The Blue Shield of California Foundation will be putting out another blast. And then, you know, the folks that signed up through this will have access to that. So, so yeah, they'll be made available so that if people that you know didn't get on, or will be able to kind of also see the webinar and hear the presentation. Okay, well, thank you so much for your time and your interest into the webinar. Oh, sorry, is there someone? Lucia? I'm hearing noises. Okay, yeah.
No. Oh, I'll just say I wanted to add my thank you, but go ahead and finish.
Okay, yeah, you should go. Okay, yeah, thank you everyone for your interest. We're really excited about, you know, about this group and who you all are out there that are really going to be part of this exciting endeavor. That's it from Goby.
Okay. I just wanted to express my thank you for joining us today, and I really encourage you to ask as many questions as you feel you have to make a decision about whether you want to be part of this process. But I really invite you to consider it strongly. I'm looking at some of the people who RSVP'd, and I would love for your name to be in the mix. So thanks.
Thanks, everyone.